Well, suicide is now listed as the biggest killer of British men under 45. So why are we failing so many people, and what can we do to reverse that alarming trend? With me now to discuss this is Dr. Karen Goodall, a chartered psychologist from the University of Edinburgh. And on the line we have Frank Ferretti, a sociologist and author. Karen Goodall, to you first. That's a pretty straight question. Why are we, in your opinion, failing so many people at the moment?
Well, I think the footage that we've seen there is really good in terms of raising some of the issues around mental health. And I think, especially for men, that's one of the issues that we've had in the past. So that we know that the suicide rates for men are much higher than for women. They're 3 times the rate. We also know that of people who commit suicide, less than 27% have actually approached someone for mental health support. So I think there really is a big issue around stigmatisation, especially for men, in terms of talking about their emotions, being able to seek help, to say, look, I'm not doing well, I need someone to support me here. I think that's one of the biggest factors.
OK, I want to bring Dr. Frank Ferretti in. Dr. Ferretti, you've written quite bluntly on this in the past, and I think would it be fair to assess your opinion as, we're sometimes too quick to categorise people, too quick to analyse?
Yes, I think we need a reality check, because what we're doing is we're eroding the line between people with genuine mental health issues and most of us who have profound existential problems. And I've been studying this for over 20 years, and year in and year out, we're told that the mental health crisis is getting worse. It's far worse than you ever imagined. And every year it seems to be the case that there's just no solution. And you would, as a sociologist or as anybody that studies epidemiology, would take a step back and say, is it really the case that there's never a solution, there's never any improvement in the problems? And it seems to me that I've drawn the conclusion that we've so drawn towards reinterpreting the problems of life as mental health issues that we're really losing sight of the situation. So at the moment we're talking about a male suicide crisis, and we forget the fact that in terms of historical patterns and statistics, the rate of suicide that's around now is not at a particular historical high. It's quite normal in terms of the way that the world works. It's a tragedy in every single instance, but we do need a reality check. And rather than continually inflate the problem, we got to ask the question, what is it that we're talking about? And the reason why I'm so concerned is because by adopting the language of mental health in this kind of promiscuous way, what we're doing is we're almost cultivating a sense of helplessness among young people, among children and youth who kind of grow up by using a psychological language and who begin to interpret their everyday existence through the prism of psychology. And through that, there's almost like a self-fulfilling prophecy, so that by the time they're 13 or 14, instead of understanding that the problem they face are normal problems of childhood, they almost encourage to think of it as a pathology, as some kind of mental health issue.
But we're hearing increasing evidence that a lot of young children are experiencing situations that are not just growing pains or the normal situations of childhood, are we not?
Well, we are, but then I think you need to take a step back, because it seems to me that children throughout modern times have always faced bullying, they always face difficult circumstances, shyness, and various kinds of problems that sometimes paralyze children in the way they make their way. And in other circumstances, we define these as existential issues that are not the object of mental health intervention, but they are to be resolved in other kinds of ways. And I think what we've done is we've told children at a very, very young age to interpret their lives in such a way that they actually believe that they got this problem. And of course, once you begin to see the problem as that of depression and stress and anxiety or some kind of phobia, you do become ill. And that's the thing that really worries me. We're almost creating...
I just want to interrupt you there and bring Karen Goodall back in, because I know you're a strong advocate of early intervention, are you? What do you make of what Frank Ferretti's saying there?
Well, I mean, I don't think there's huge numbers of children who are being overdiagnosed with anxiety and depression disorders. And I think there's not a clear cutoff between what is a disorder and people who would be slightly underneath the cutoff for a mental health disorder. Those people may still be experiencing high levels of distress. And I don't think we can just turn a blind eye to children who are reporting with high levels of distress.
Can I ask you a broader question? If you don't have money in our society at the moment, what is available to you in terms of help, other than months potentially waiting for an appointment with a counsellor or so on? Is it good enough, the situation that we're facing at the moment?
I mean, I don't think there is enough money in mental health generally, especially for the children and young people's mental health services. There are long waiting lists, and when children are presenting with high levels of distress, that really isn't good enough. There needs to be something that happens earlier for those children who are experiencing the distress. I mean, I think there are a lot of really good third sector organisations which are providing quite good services, but they're not specifically for children who are diagnosed with disorders, but they would help for children who are experiencing distress. And I think this is one of the issues that the Scottish Government has targeted with their new intervention, is treating people compassionately who present with distress, and then being able to signpost them to third sector organisations that can actually provide a bit of support.
All right, listen, we could talk about this for a long time, and I'm sure we'll come back to it before much longer, but in the meantime, Dr. Karen Goodall and Frank Ferretti, thank you very much indeed for your opinions this evening.